Hello, I'm Dr. Shna from Epilium Company. Today we have the pleasure of hosting Dr. Hanar Ahmed, a board-certified dermatologist specialized in skin and laser treatments. In this video, we'll be discussing laser hair removal and we'll be providing some insights into hair removal laser technologies. Welcome, Dr. Hanar.
Thank you so much, Dr. Shana.
As we all know, laser hair removal has become a trend, even a routine in many people's lives. Dr. Hanar, how important is it for a patient to consult a specialized doctor before starting their sessions?
Thank you, Dr. Shana. Yes, of course. As we know nowadays, laser hair removal it became widespread and became a trend, really. Why it is important to the patient to see the dermatologist before doing the laser sessions? Because for many reasons. The first and the most important point is that as a dermatologist, we should know that this hair growth is within the normal range or not. Because as we know, the hair growth is a natural process, but sometimes the patient may notice a sudden or excessive hair growth in a very short time. At that time, we should tell the patient to, or we should investigate the patient to find the correct cause or the right cause behind this hair. As we know, there are many causes like hormonal imbalances and many abnormality in thyroid gland or polycystic ovary or many medications. So at that time, we should first treat the cause and then we should start the sessions. And the second important point is that we should ask the patient if she is using any medication or not, because as we know, many medications that increase the skin sensitivity and causing irritation or burning. For example, isotretinoin. If the patient is on isotretinoin or she did chemical peeling or CO2 laser, we should tell the patient to wait for a while to avoid laser sessions. Then we put for him and for her sessions.
Very well, Dr. Hanar. Very nice explanation. Another common question is that we get asked a lot by the patients is that why isn't fine hair or white hair is not removed by laser?
Yes, it's a nice question. To answer this question, really, we should first know or understand how laser work. Laser is a light, as we know. Laser is a light. This light is absorbed by the pigment, which is called melanin. This melanin is present in the hair follicle. This light is absorbed by the hair follicle, this pigment, then it will change to the thermal energy. This thermal energy causing damaging to the hair follicle and stop it from the growth. So as we know that the white hair lacks melanin and it contains no melanin. So at that time, there is no pigment to absorb the light and there is no formation of thermal energy. At that time, there is no destruction or for the hair follicle.
Dr. Hanar, there's another question. We see many patients at very young age, they have hair problems, okay?
Yes.
So which age is considered safe and appropriate for starting laser treatment?
Yes. Really, there is no right age for starting laser sessions. The best time, or we can say the right time for doing laser is when she enter the puberty and the first menstrual cycle. She can start laser sessions, but it's better to do when the hormonal fluctuations are become more stable.
Dr. Hanar, why is it important for patients to remove their hair before each session? And which method is recommended by you? Waxing or shaving?
Yes. Shaving before the hair removal session is not only important, it is crucial. Why? Because if we did shaving before the laser hair removal sessions, the light source or the laser is directly target the hair follicle. And by this, we're maximizing the effectiveness of the laser. But if we not shave before the laser, what happens? This laser light is absorbed also by the pigment that's present in the hair above the skin. At that time, the effectiveness of the laser will decrease, and also it may cause skin barrier. For this reason, we advise to shave before laser session. And shaving is better. Why? Because we don't want to remove the hair from its follicle. We need the follicle. In waxing, we distract it, or we extract it. Sorry, we extract the hair from its follicle. So at that time, there is no follicle to laser target it. So better to shave just the upper part, or the part that above the skin. I will remove by shaving to laser target the hair follicle directly and decrease the side effect like skin burn.
Okay. What about pregnant women? Is it safe for them to do their laser sessions during their pregnancy?
Yes, really, generally, we recommend it for the patients to avoid laser hair removal session during pregnancy. Why? Because of because there is a lack of researches about the safety on fetus. Although there is no an exact or an there is no clear evidence about the laser hair removal is harmful, because the laser light is only through past the skin and the hair follicle. But because of the safety of the fetus and, as we said, lacks of data, so we recommend to avoid not only laser. Really, I myself, I will recommend for patient to avoid any aesthetic procedure during pregnancy. Better.
Okay. Dr. Hanar, what are the effects of menstrual cycle on the outcomes and the experience of laser sessions?
Really, this question faces to us many times. The menstrual cycle has no effect on the outcome of the laser hair removal sessions, really. There is hormonal fluctuation, but it is not like hormonal imbalances disease. As we said, if there is any abnormality in the hormones, it has direct effect on the result. But the hormonal fluctuations that occur during menstrual cycle has no effect, really. But it increases the skin sensitivity, and the patient may increase the pain sense during sessions. Otherwise, has no effect on the outcome.
Dr. Hanar, why is it that some patients notice that some hair grows back after a few days of their session? What's the reason behind that?
Yes, really, this is not a regrowing of the hair. This is a shedding. And shedding is a normal process that occurs usually after that the hair follicle is distracted. The shedding process will start, and it occurs first week or few weeks after the first session. Usually it's happen, and sometimes the patient blame about that the laser is not effective, or the hair is regrowing. But really, this is not regrowing, and to be sure that this is not growing, we can extract the hair, and it is very easily shed. It will shed, and this is the shedding process, really, as we said.
Thank you, Dr. Hanar. And which laser machine do you usually recommend for your clients?
Yes, as a dermatologist, we usually search for devices or high quality lasers. And in my clinic, I will use an epithelium laser. It acts by a new upgrade IPL system. It's a very safe and a very great result, really. And I will recommend for my patients.
Thank you very much, Dr. Hanar, for sharing this valuable information. We hope it's beneficial for our viewers.